Hey guys, this is Haley Arceneaux, and I will be giving a brief presentation on Wilms tumor, from the etiology to making the diagnosis, treatment, prognosis, and follow-up. Wilms tumor is a childhood cancer of the kidney and one of the most common solid tumors in kids. It usually presents between ages 1 and 5 and affects 1 out of every 10,000 children. Histologically, Wilms tumor is composed of embryonic tissue. Wilms tumor usually presents in just one kidney, but can also present bilaterally. This is seen in later stages as the disease metastasizes. Typically, Wilms tumor is found before the patient has any symptoms. Most commonly, it is discovered incidentally as a firm, non-tender, smooth abdominal mass, and it does not cross the midline. If a patient does have symptoms, they have constitutional symptoms such as fever, weight loss, weakness, anorexia, or vague abdominal enlargement. Some other signs that may be noted in workup are hematuria and hypertension. Hypertension is caused from increased renin production by the tumor. If you suspect Wilms tumor, go ahead and order an abdominal ultrasound. This is the first diagnostic modality used by providers because it can show that the tumor is really in the kidney and it can rule out a few differentials. To assess if the disease has metastasized or not, use CT or MRI to stage the disease. But the gold standard for diagnosing Wilms tumor is histological diagnosis in the form of a biopsy. Some differentials for Wilms tumor are hydronephrosis and multicystic kidney disease, because these two diseases can cause an abdominal mass and some urinary symptoms. Neuroblastoma is another common solid tumor in children. Neuroblastoma usually originates from the adrenal glands, so it's important to differentiate these tumors as they will both present with constitutional symptoms and abdominal pain and enlargement. In the U.S., patients undergo nephrectomy and then followed by chemotherapy. Usually radiation is not indicated unless the disease presents at a higher stage. For patients with Wilms tumor in both kidneys, they receive preoperative chemotherapy to shrink the tumors, and then they undergo a nephron-sparing surgery, and it salvages the healthy nephrons and promotes kidney function. There are two different types of Wilms tumor, and they're differentiated by histology. There's favorable histology and anaplastic histology. Favorable carries a much better prognosis, as the name implies, and prognosis is determined both by stage of disease at presentation and by type of histology. The types of chemotherapy used can cause cardiac toxicity, and radiation can cause local damage, leading to a higher chance of secondary malignancies. Portal hypertension is a side effect of radiation to the abdomen and damage to the portal system. This is seen more commonly in patients who had a right-sided Wilms tumor who underwent radiation because that caused damage to the liver and the portal system on that side. Renal failure is seen in patients with bilateral disease when they do not have healthy nephrons to salvage in surgery. Survivors follow up with routine ultrasounds and CT scans every few months for 5 years. They're also screened at that time for long-term side effects of treatment with annual echocardiograms, blood work, and urinalysis. The best way to give children with Wilms tumor a good chance at survival is to catch it early. It's very important for pediatricians to perform a full abdominal exam at checkups and to be aware of Wilms tumor. Wilms tumor can be very curable, especially if it's caught early. Now, a typical PANCE question that you might see about Wilms tumor is if there's a young child with an abdominal mass found on exam and no other symptoms, go ahead and put Wilms tumor and be glad you watched this presentation. Here is a list of references that I used for this presentation. I hope you all have a clearer picture of Wilms' tumor. Thanks, guys.